We have to start a class with the linguistic, the marking criteria. In the linguistic, the first and foremost thing is the fluency. What do you mean by the fluency? You should have an ability to speak at length, first of all, to speak at length without hesitation. What I mean by without hesitation, people normally take pauses such as ahs and ums, lots of pauses. So try not to have the pauses. Try to speak slowly, gently, but in a fluent manner. The natural flow of speech should be maintained, right? So we should speak fluently as per the definition of the fluency, right? So this is the first thing that they will be assessing when they'll be checking your speaking part, right? So in this part, as you can see there, the person should speak, you can say, English language in that fluent manner in which you will be speaking your native language, right? So, in simple word, it's your natural flow of speech. In simple word, it's your natural flow of speech, right? This is called as fluency. And the second part is called as intelligibility. So, in term of intelligibility, the first and foremost thing that you must have clear pronunciation. You should be able to speak with clear pronunciation, right? What is exactly we can relate the pronunciation, that how would you pronounce certain word? So in simple word, it's your stress management. I mean to say that where you put high and where you put low in the speech. So basically in broader spectrum, it's your intonation, tone management. It's something that is quite important for you to learn the skills, because if you would not be able to pronounce certain words such as that, how would you pronounce that word? If you pronounce this word as mood, let's say, it would not be it might not be the right pronunciation. It should be pronounced with stress on this part because of the vowel over here. Similarly, the way you pronounce this word, it is detail, stress on this part, detail, not detail, right? So you have to make sure the way you are using your general pronunciation. Secondly, when you are speaking at, let's say, if there is sentence and you have to speak that sentence, there might be highs and lows in that sentence, right? So according to the appropriateness, like how would you put stress? Let's say I would start my speaking, and if I have to explain something, maybe I can start with this formality, like maybe, okay, depending upon the importance of the event. So let's say I can start. First of all, it is quite important to modify your diet. So it will help you to control your symptoms. In addition to that, also try to add blah blah food. Now, as you can see, the diet was the major topic, and blah blah food was the subtopic in this diet. So I am hitting this thing from the normal tone, but less in, you can say, frequency than the your diet. Then I can move on to the next area, maybe exercise. It's more important than diet. If in addition to that, and more importantly, for stress, more importantly, exercise is the exercise should also help you to improve your condition. So, according to the formality of the card, you need to learn that where should I put stress at which part of the sentence. So, but I can define the intonation can be defined into two levels. The first level is the level of word, like how would you articulate your words as per the importance of stress. Or secondly, it is also important for you to know that which part of the sentence should be stressed from higher tone as compared to the rest of the sentence. Let's say, if I can speak, how can I help you? Let's say, so this part should be more stress. How can I help you? Right? So what bring you over here? So what bring you over here? You can see naturally brain is more important, right? Or let's say where exactly you have pain, right? So exactly and pain because the adjective, sorry, because of the emphasis location we are using over here, and then the pain. Where exactly you have pain, so we put stress on those things. So we need to know at which part of the sentence we'll put more stress as compared to the rest of the words, right? Anyhow, so this is the intonation or the intelligibility, where we have the pronunciation, where we have the intonation and correct word stress. Remember that you should not work on your accent because they are not going to judge your accent. They are just looking for your ability to speak clearly. As long as you are clear in your accent and it's understandable, no need to work on, like to make up your accent. No, not to fake up your accent, right? Anyhow, afterward, you can see that we have appropriateness, the third criteria in here. What is appropriateness? In simple word, is the selection of right tone, like the tone management. The selection of right tone is the that right. Okay. So basically, we were discussing about the appropriateness. Like we have tone. You should work on the tone that you must have appropriate tone, right? You need to know like where and when we have to use the appropriate tone. Okay. Secondly, if you can see there that the formality, like if it's emergency setting or if it's a normal setting, you must have the right formality. Okay. And then the jargon, like you should not use the medical terms. Avoid the medical terms, right? This is jargon. And last but not least is the grammar part. We must use the range of grammar in here. I would use the grammatical structure. The plus point in here, if you are going for the speaking as a first encounter, so you can see that most of the time we have the you can say the grammar is already available. Like you will be using the range of grammatical structure. For example, in inquiry, is there any family history? Like say, do you know about? Let's say, how about is what about when? So these are some of the grammatical range: is, do, when, how, and even tagging question, statement based question. So these are some of the questions that you must ask from the patient, right? So expression of grammar is important, and more important thing in speaking is your expression, because most of us are expressionless. Try to have the variety of expression in your speaking part. So these are the some of the chunk of discussion regarding your speaking criteria in terms of linguistic. If you like to ask, discuss this card. Now, this is a kind of scenario. The patient is operating in operating theater recovery room. It's a different scenario as we discussed that we'll be discussing different types of card today. So we have to read like you are a nurse in this theater recovery room. There is a patient who is 80-year old. This is the name that has already been mentioned. Normally, we don't have the name, and he is recovering from hip replacement surgery. Currently, he is on IV fluids, and she can tell you her name, but otherwise she's disoriented, and she keeps asking to see her doctor. So we have to be quite vigilant. It will show you the nature of patient that she might not give you any attention, and she will be focusing on this point, like where is my daughter, where is my daughter, right? So if you can see, first you have to explain her situation, like start the card in this way. Hello, my name is, let's say, blah blah. I'm one of the nurse in this operating theater suite. If I'm not wrong, I'm talking to Miss Doris Mack, and you recently had a surgery. So I believe that your stay in the like your surgery was uneventful. And right now, if you have any question regarding to situation, you can ask. She can ask you about the daughter. Okay, I will address you. She's waiting for you. But can I check the basic, like check for understanding, if you don't mind? Can you tell me do you remember what's the date today and where you are in time? So date, time, and location can be asked to check the understanding. She will not be listening to you. We explain if necessary. Try to control your nerves because there's a possibility while the patient will be asking the same thing and again, your tone can be aggressive. So please control your tone in case the patient can give you tough time. Then you have to advise the patient that her daughter is waiting to in the post-operative ward. This is the hospital policy. You have to educate the patient that your daughter is in the visiting room, and then she will ask about the cup of tea. You have to explain as recently you have the surgery, and we have to wait for a while. Otherwise, like it might have the choking episode, and it will go into the, you can say, your air pipe. Then we can move on. That you'll be fine soon, and we'll be shifting you to the ward, right? So this is the one of the push that we can do this card. So please be quick with me right now. I want one of you to have this card with me.
Currently in
Where is
the
Sarah? I need to
okay,
see her.
okay. She's currently in the
Where I am right
post-operative.
now, I just need to see
Okay,
Sarah.
ma'am.
Please, can you help me?
Yes, I'm here to help you out.
I just
Let
need
me
to
explain
see
you.
Sarah.
Sarah is
Like, I
currently
can have a
in
cup
the
of tea, please.
yes, we will fulfill your all needs. Let me explain you first. Your daughter is currently in the post-operative ward, where you will be shifted shortly after the recovery of your condition. You just went through the surgery,
I
and
just need your help.
because of
Can you call
anesthesia.
Sarah in here because I need to see her in here. Can you call her in here, please?
Yes, ma'am, we can call her here, but not in the recovery room because our policy of the hospital does not allow that. So you just have to wait a little bit until your condition is much more recovered. And the second
Okay,
thing
so
you asked is
but please
the cup
give
of
me
tea.
some tea maybe because my mouth is quite dry. I just need to have some cup of tea.
Okay, ma'am. For your this need, we have started the IV fluid that you can see the drip over here. We cannot currently give you the anything by mouth because of the effect of anesthesia that can cause you vomiting. As I already stated you that you are in the recovery room, and if we will give you the cup of tea right now, you might be having vomiting. So to avoid this kind of condition, we are unable to give you the cup of tea right now, and I'm extremely sorry for that. And I'm hopefully to having your patience and cooperation.
Mm-hmm.
Any further thing you want to ask me
No,
regarding
it's
this?
fine. I just want to see my daughter Sarah as quickly as I can
Yes, you
when
will
I can be in the
be
ward.
shortly shifted in the you will be shortly shifted in the post-operative ward as per the order of physicians and according to your condition. And we are here for you to cooperate fully with you. So kindly just have a patience a little bit. I'm here for you and I will take good care of you. You need not to worry about anything.
Okay, okay.
Any further questions you want
No,
me
it's
to
fine now.
explain you? Okay, just relax and try to keep yourself calm.
Okay, thank you very much, ma'am, for your time. Anyhow, it was fine,
Mm-hmm.
but try to start with, you can say, warm welcome. Uh, Hello, Mark. How you have been? I believe that you recently had this surgery done, and you know that you are in the recovery room, right? Oh, sorry, we have the name given. Hello, Mac. I believe that you are recovering well. I can see that you are in the recovery room. So before we can proceed further, if you like to ask any question, please feel free to ask me. Uh, then he will ask you like, "What is my daughter?" Mark, it's understandable that you must be concerned to see your daughter. However, she is waiting for you just in the ward. When you'll be shifted into the ward, then she will be there. I need to ask you a few questions. Can I? She might not be listening to you after that when she gave you the opportunity. So check for the understanding, which include the age, sorry, the time, the place, maybe, and the date. Okay, like, can you tell me, do you know the date and where are you right now? And you remember that you had a surgery, maybe? And okay, no worries, I will explain it to you again. So work on your tone, try to make it more polite, right? Then you can tell her, Miss Mac, I can understand your concern is understandable. However, as you just had a surgery, so your daughter is waiting in the ward after the recovery room when they will, monitor you, and you'll be safe to transfer. We will send you to the post-operative ward where you can see your daughter. Okay? Then she'll push you again. Smack is totally understandable. As per the standard operating protocols of recovery room, there is no visitor policy. Like nobody other than healthcare professional and specific staff are being allowed to visit this place only. Okay. Then she'll ask you about the D. Okay, Mac, I understand that. However, at this point of time, you can see that this drip is being running on you, and I cannot give you any medicine or any fluids by mouth at this stage, as you recently had surgery. So we have to wait for some time. Okay, and then again assure the patient that she will be in the ward, and after doctor's suggestion, we can advise what need to be done accordingly. Okay. Okay, so if
Can
you're
I
ready,
start?
you can start the card. Yes, please. You have 5 minutes time, 5 to 6 minutes time to complete the task. So you can start now. This is practice or demo session for your speaking. So I'll be your interlocutor.
Uh,
So you were given 2 minutes time beforehand. Now we are going to start the card. Your time starts now, please.
Hello, sir. My name is Rachel. I am in charge of the nursing home. I feel that you are a bit concerned and you are very worried about the condition of your father. Let me help you if you have any questions.
Well, thank you, nurse. I appreciate your understanding and concern for my father. And yes, I have some concern basically about my father. Like I want to ask you that do you have any alternative to this feeding tubes? Because I can feel that my father is not comfortable with that, and I would like if you can tell me about alternative.
Yes, I feel that you are very bit worried, but your father is have a recently stroke, and it is very safe for him to be fed by a nasal tube. This tube in the nose, because it is quite easy for your father to have some nutrition via this tube in liquid form because he is unable to eat something, and it is the best possible thing for your father for the nutrition purpose. And I feel that by the help of this nasal tube, your father will be easily recover uh, by getting the nutrition.
Okay,
Uh,
okay,
and there are many things I want you to tell about this tube because it prevents the patient from the choking, and because when the stroke happens, the patients are unable to swallow things easily, and it is very dangerous for them to take the food into trachea and have a choke. So the tubes easily directly pass the food in the stomach, and it is easy for the patient to get the nutrition.
okay. That's I'm very thankful for such a
Anything else
comprehensive
you want to ask
explanation.
me?
Yeah, I'm very thankful for such a comprehensive explanation. But I would like to ask some other concern of mine. My other concern is about the lifting machine. So, if you can tell me about the like safety of the lifting machine, because I'm also concerned about that.
Yes, yes, please. The use and the purpose of the lifting machine is to keep the patient safe when we have to take the patient or transfer the patient from the bed to the chair or take the patient for outside for the walk. And in the lifting machine also improve the circulation, blood circulation of the patient, because when you are in the lifting machine, you can in sitting posture, and this portion improve the blood circulation of the patient, and it is very convenient for the healthcare workers to transfer the patient from the bed to the chair or take for the daily care activities of the patient.
Okay, that's
So I
fine.
think you should
Yeah, one more
not worry
thing.
about this thing because
Yeah,
it is.
one more thing.
Yes, yes,
I really
please.
thankful for
Anything else
explanation of
you
your.
want to ask from me?
Yeah, I want to ask you about the privacy because like as my father is recovering from stroke, so he's bedbound. So I'm quite concerned about the privacy. Hello.
It's the patient. Hello.
Yeah, yeah.
It's the patient right to be have the uh, so the privacy is maintained. You can easily draw your bed curtains when we have to change the patient or give a sponge bath to the patient, and the door of the room is completely shut for the purpose of convenience and also for the safety and privacy of the patient. So I think these issue will be
you don't have any problem regarding this privacy issue because it is the nursing first right to keep the patient private and no shame or patient safety is our priority.
Okay, thank you. Thank you for explanation.
Sir, do you have any other question regarding your
Uh,
patient condition or the service
this I
and the
appreciate.
health?
I appreciate all of your guideline, and it was quite comprehensive. Now I understood what my father was facing and what he was having. So it's really understandable. And
Do you have any further queries? You
now
are available for the time.
thank you very much for your time. Okay, ma'am. It was,
Thank you,
first of
sir.
all, let me really appreciate you that it was very well managed card, very comprehensive, to the point, and you address all the concern of the patient, right? You were fluent enough. There was no too little grammatical mistake, and you try to remain patient focused. You have addressed the concern of the patient at the same time. You have moved the card in a clear flow, maintain the coherence in the card. However, I would like to add some areas. First of all, do ask the patient, like, what is his concern about the, we can say, this lifting machine. What he's concerned about, right? Number one. Number second thing is,
Okay.
like, you can ask the knowledge of the feeding tube, but the patient is having knowledge about that. And second thing is, we can see there that you have to use the cohesive devices. Specifically, you can see there are two set of areas that can be listed with the cohesive devices. It will be, although
Okay.
you have explained it quite well, but by using the cohesive devices, because the sequencing is very important skills when you go for the education of the patient. So as you can see over here, we are educating the patient about his concerns. So we have 3 points to be made. So you can use the cohesive devices. Okay, to begin with, first and foremost, the function of this feeding tube, as considering your father's recent stroke, it will help the patient to avoid any choking episode, right? Like any food particle, if
Okay.
you can take orally, there's a possibility that it can, like, struck in the food pipe of your father, and there could be a episode of choking. Okay, so first and foremost priority for us, the one of the most safest method, and why we are using that, it will prevent the choking episode. Okay, in addition to the choking
Okay.
episode, the second important factor, as you can see, the person need to have the complete the nutrition requirement. So this feeding tube will complete the nutrition requirement. Okay. So I believe that I have
Okay.
made myself clear with reference to your concern of feeding tube. If you don't have any question, I'd like to move on toward any other concern of yours if you want to ask. So this was the transition between two tasks, like from one to two. Like you are moving from the explanation of this feeding tube. Now you are moving toward the lifting machine. So basically, you have to take a clear transition. After taking that transition
Okay.
part, you can see that we have to move on toward the next part, that is your lifting machine. So you can again use the lifting machine. Let's say if I have used the cohesive devices, let firstly, secondly, over here, I can use the other cohesive devices such as, in addition to that, moreover. So you can see. So let me assure you that the we can say lifting machine are quite safe. You know, in this regard, that it will help the patient to improve their mobility. Moreover, it will make it more convenient for the healthcare professional when they have to make the shift from bed to chair and chair to shower and so on. So again, give you assurance that it might not be, like, any give harm to the patient, whether it will be more safe. Okay. Oh, lastly, that you're concerned about privacy. So let me show you again that you can say, your the privacy is the topmost concern, and it's being the standard procedure for us for being a nurse, that we always draw down the curtains and we close the door whenever we go for any procedure. Okay, that need privacy. So I believe that I have made myself clear. Is there anything else? Okay, if you don't have any question, I'd like to summarize like that.
Mister, how are you?
I'm not well. I'm having abdominal pain. It's quite severe. And
You look
I
very
just need to ask you
anxious.
that why this I have been asked to do go for some test.
Okay. Uh, I'm. My name is Mariam. I am a staff over here, and to take care and to proper telling about your investigations. Uh, you have look very anxious.
Yeah, I'm quite concerned that what it
Tell
could
me
be.
about your condition.
Yeah, I need to ask you,
Yes.
I was having severe abdominal pain recently, and the
Yes.
doctor ordered some tests. So I need to ask you that what they're looking for. I am quite concerned.
Yes. You look so anxious. I
Mhm.
understand your feeling. Um, yes, I tell you about the investigations which have
Mhm.
been taken for your better treatment.
Mhm.
Mm, you have been abdominal pain for a few weeks ago. Am I right?
Yeah.
Uh, okay. Uh, acha, I will tell you about that. This pain maybe you may have indigestion problem
Yeah, I
and
have the indigestion problem.
irritability. Okay. You may have uh, pain in the stomach,
Mhm.
irritability,
Mhm.
and ulcers.
Mhm. I don't know. Like, can you tell me what it is actually?
It is you may feel pain in the abdomen, and it may be feel like and nausea, vomiting,
Mhm.
and pain, mostly pain and very cracky pain.
Mhm. And what are these tests? I was been told that I have some tests to go. What are these tests?
Yes, we perform some tests to better understand for your condition. It's
Mhm.
a gastroscopy test, which
Mhm.
may be that we have some camera and
Mhm.
like tube insert in your stomach to
Mhm.
see the complications which are occur in your stomach,
Mhm.
and a barium meal which may be some medicine which give you before meal that
Mhm.
to see your inner ulcers and inner problems in the stomach which may cause pain.
Okay.
So
Okay.
you can't be
I'm
worried about that. This
yeah,
is necessary for your
I was
treatment
quite
plan.
concerned. Yeah.
Yes. If you ask any question about that, then I can ask
But I
tell
was
you
just
about the
concerned. I was just
condition.
concerned that it could be something serious or what, like a cancer. That was my concern, actually.
Okay. Uh, what concerns?
I was just concerned that it could be something serious like a cancer.
No, no, it's not like that. It's like testing about the for location for your pain, and for uh, gastroscopy will be done to see the um
Okay. For your time. I appreciate that, ma'am. But you can start a card. Hello, Mr. Mark. You seems to be quite concerned. Is everything all right? Oh, I understand that. You, but let me show you that nothing to be worried about. We can just investigate. So let me ask you some question that as you mentioned that you were having this abdominal pain. So how long you have been having this pain? Hmm. And are they constant or like have you noticed any triggering factor or what about the relieving factor? Like that. You need to ask something about triggering, something about relieving factor. Okay, in your counseling session. Afterward, you can tell the patient, okay, there might be multiple reasons behind your pain. So to begin with, first and foremost, that we can have this pain just because of indigestion. Use the cohesive devices. Secondly, there might be the gallbladder stone, the stone in your gallbladder. Uh, like I don't know how to use the layman term for that. Anyhow, then we have the irritable bowel. and maybe ulcer, etc. The wound in the stomach. So this could be the possible reason due to the pain. However, for that reason, doctor has advised the blood test so that they can see inside of your stomach. So rest assure you that you should not be worried of. Like it should be something serious, not that much serious. Don't worry. Okay. So you have to, you can say, address the patient concern in this approach. So have I made myself clear? If you want to ask any question.